We're now going to discuss attention deficit hyperactivity disorder. This is something that's very common on the exam. It is, again, a diagnosis that is made by exclusion and by following certain criteria. There's no specific test for this. There's no one best test. It's a diagnosis that you make using certain criteria. And certainly inattention is one of them. These are patients that are very easily distracted. They may be in school and the bird singing outside will distract them, or the noise of the air conditioner or something else will distract them, so they're not really paying attention to what they should be doing. They're not focusing. Consequently, they don't do well in school because they're missing a lot of what's going on in the school. Also, another characteristic is impulsivity. They really sometimes will do things or speak before thinking about it. Hyperactivity is not always present. If it's present, it's more common in boys. These symptoms must appear in at least two settings. It's not just happening in the school, but it can happen at home and school. That's a lot more valid for your diagnosis. Again, age is important, and some symptoms should be seen before age 7 and should have at least 6 months of duration of these symptoms before you can start labeling them as ADHD. And it is a diagnosis of exclusion. You need to make sure that there's not something else going on, like a learning disability, and the child is not doing well in school because of that. Again, it's more common in boys, and the hyperactivity component of that is also more common in boys. It is a clinical diagnosis. It can persist into adulthood. Some children, as they get older, are able to control their impulses better, but it can progress into adulthood, and it's being recognized more and more in the adult population. Again, there is no clear cause. There is no correlation between a diet. People talk about red dye number 2. They talk about chocolate and things like that. There is no correlation between diet and developing ADHD. Treatment consists of, first of all, you have to do testing to make sure they don't have other learning disabilities. Treatment consists of smaller groups and some of the medications, such as the dextroamphetamine and the other somewhat stimulant medications. Methylphenidate is probably the first-line drug for treatment of attention deficit hyperactivity disorder. As patients get older, there will be a decrease in the hyperactivity, but the other components may worsen, and this can cause into adulthood difficulties with establishing and maintaining relationships. Also, there is a higher risk for accidents and injuries simply because of the hyperactivity. There's also problems holding down a job later on as an adult, and there's a higher risk for criminal activities in adulthood.